So
right,
there is
good.
this
Okay,
huge
yeah.
growing body of evidence about scar mobilisation and mobilising the scar, early interventions in scar management, coupled with good hydration, good nutrition, you know, engaging with that scar. But also in my clinical practice over the last 11 years plus, since incorporating scar treatment, I have such good outcomes. I don't think it's just me. I think it is now acknowledging the scar. Because let's say you've had life-saving surgery and now you've come to see your therapist and, you know, and you've got shoulder pain. Wouldn't it be helpful if I actually asked you, so how does the scars make you feel, or how do they impact you? Because if you're walking around like this because actually you hate them and they hurt, that's probably going to cause some of your shoulder pain. So let's look at that. And I'm not saying that we have to be, you know, now trained counsellors and yes, now we're doing X, Y, and Z, but just to acknowledge that they're there, I think is the first step. And
the research that you talked about, is that, I don't want to use the term credible research, but everybody talks about, you know, randomised, placebo-controlled, double-blinded RCTs. Is it that quality of research?
Very few limited studies are randomised controlled trials, and the ones that I've been reading use a very small sample size.
Right.
So we're talking 10, 20, 50 patients. With the PhD that I'm doing, I'm looking at about 150 to 200 C-section clients that I want to treat to see a difference. I know in my own clinical experience, I don't know how many thousands of clients that I've treated now, but with scar therapy, I find significant improvements in their outcomes.
And I'm making an assumption here that there will be a control group in your research here, so we can say this lot didn't. No,
absolutely. So some of the clients who I'm going to have, I will do scar massage on them, and some of them I'll do scar massage and use the negative pressure and see if there's a difference. And yes, of course, I'll have clients that potentially will come to me and I'll say, oh, here, let's just give you a program and see how you get on with it and see the difference between intervention and no intervention at all.